Good morning everyone. Being a hair restoration doctor actually is a very interesting job and it's a very passion job because every day you deal with patients who come in, their age is different, their texture, their hair color is different and the race is different. So we have as a hair restoration doctor, you have to do the advice and protocol and design the hairline following to the individual. So also the donor supply, how many grams you can take. There's a lot of things to consider. It's not just one or two. That's why it is a long learning curve to get the best results. And if you go to see any doctors, ask them photos of 4 years, 5 years, not 3-4 months. That's not the way to go. So because it is a long learning curve, there's a lot of things to learn, there's a lot of things to understand, and there's a lot of things to advise to patient. Today, I'm lucky that I've got a Caucasian patient with me who came and consult me the other day. I went back to France for a short break and he's back here to do his hair restoration. The hairline that I've done for him is also the way that he wants. He doesn't want to lower it too much. He just wanting to look very natural. And the way he's lost his hair is actually more focused on his crown area. So we already decided on the hairline, and like I said, Caucasian has their own way of the hair design, which he and me already discussed. And right now we're going to start the procedure, but before that let me show you a very conservative hairline. Look at it here. Once the hair, once I transplant the hair here, it will drop down and it will go up. So it's going to look so natural that even his barber may not even know that it's done hair restoration. And we look at him, he still got a lot of hair here, so there'll be a little bit planting going on, but this is where his main concern is. A huge area of hair loss in the crown. So if you look at it, it's actually in Norwood 6 male pattern baldness. So the procedure is going to be from the hairline up to the crown area today. So you need a lot of grafts. So again, Caucasian has their own texture. They've got a lot of each graft. They will be having mostly a lot of 2 hairs, and the hair length is longer. So all this bearing in mind, you're gonna have awesome results. So with his age, we have decided and came to a conclusion that he'll be doing 3,500 grafts for today. So I wish my patient all the best, and also to thank my patient for allowing me to take this video. Thank you so much. So we're going to start the procedure, and thumbs up to Dr. Inder.